Welcome to Graceful Aging. I'm your host, Gregory Bader. Today we're going to talk about the status of our healthcare industry and what we might expect going forward, and most importantly, how we might be better consumers for ourselves and our families. And I'm so happy that we have Gail Miller, who's from Humana Care. The healthcare industry has been a hot topic over really the last couple of years, but it's changing, isn't it?
It really is changing, and I think ultimately it will be a change for the good. I think over time that consumers are starting to understand their role in the healthcare process. The boomer mindset is starting to creep into the people that are already over age 65. And they have more of a consultative bearing, They're used to using consultants. And so what their physician says, they want to go out and they want to validate it.
And the notion that the healthcare system was a series of institutions or ethical medical professionals and then insurance companies with the advent of managed care that made up the deciding body. They were the deciders. And what we see fundamentally has shifted is that the deciders, to borrow, I love Jean's comment about the doctor is the second opinion. The first opinion, the consensus that gets built is the consensus that the patient builds for their own truth. They have access to most of the same information that a physician had access to.
They want to participate in their health care, and they want to be armed with information. It's important to choose a quality source if you're going to be out there looking for health information.
And in kind of sifting through all of this massive amount of information that's out there about healthcare systems, it can be overwhelming for people.
Absolutely, absolutely.
How do you simplify it for, say, someone who's 60 years of age and older?
There are a lot of choices now in how your conditions can be treated. And it's really important for a consumer to understand exactly what the physician is recommending and what their options are. So I think that using decision tools that are available on the web and lots of very credible websites, and understanding what your role in your recovery is so that you can maximize your recovery and get the result you want is really important, because we all have to make individual decisions about what it is we want to do and how we want to live our lives. And so it's important to be armed with information and then challenge your doctor to make sure that you're doing the thing that's going to be best for you and your family.
You're facing a medical decision. You may be nervous or even scared. But remember, like buying a car, choosing a school, or deciding where to live, the best choice for you may not be the best choice for someone else. Ask questions. Work with your healthcare team to understand your options. Know both their risks and benefits. Now you'll be able to work with your team to make a shared medical decision that's right for you. Shared decision-making is what keeps you at the center of your healthcare team.
You're part of Humana Cares.
We are the complex and chronic care arm of Humana. Now, we manage all of the people that are under care management in the Humana insurance business because they know the value of care management and how it can help people reduce their overall health care costs and keep them healthier.
Geriatric care managers can help save families dollars and time. Time is money as well, especially if you're going to lose employment pay to take off time to take care of mom or dad. The other thing when it comes to resources is entitlements. There are entitlements, things that you are entitled to in this country that a lot of families and individuals are unaware of, and sometimes even the professionals they're working with. But that care manager is going to guide you, save you a lot of money and a lot of time.
Examples of that are when people need transportation to get to the doctor, if they need meal services, if they need ramps to get safely inside and out of their home. We can help people find those kinds of services, and those things actually improve their overall health condition.
So let's talk about care managers and
Sure.
care management. A care manager, how can that help an individual?
Well, we work in a holistic method. We don't look at people as a condition. We actually want to understand the entire person. So the way that it helps is if you're a relatively healthy person, one of the things that we would do would be to do a couple-hour assessment with you. When people enter care management, they always work with the same people. You know, they always have the same nurse quarterback, and they always have the same field care manager. We only go out into the home when we begin to understand that there may be a problem there that we can help. What we find is that people are incredibly grateful because they're often in situations where they don't know where to go for help. They don't know that in a community you can get help to have a ramp built. You know, they don't know that there are services that will pick you up and take you to the doctors. So we connect them, and let me make this really clear, is that the person is always in the center. When we arrange for those services, we don't do that in isolation. We actually make the phone call with our member on the line with us. So we actually walk with them to help them apply for the services that they need, and then we assist them if they need help filling out the applications and things like that. Sometimes we do a lot of caregiver training so that we can help the people at home understand what that particular patient is dealing with. Right. It's highly customized, but you know, let's face it, if you're worrying about whether or not you're going to have anything to eat tonight, you're not worried about testing your diabetes. You need to help with all of those socioeconomic factors that go on in the home before you can even get to some of the more health-related things that you can do to start to modify behavior that can get you a better health outcome. It's important that you stay involved in your own health care. And yes, I mean, I think that for all of us, it's important to take a good interest in our wellness and preventative care so that we can address issues before they become big issues.
Okay.
It's important to prevent the crisis if you can.
The kind of the new part of our healthcare going forward is individuals who have recognized crises or multiple issues. We have a system of care management that is recognized, that is looking at the whole person to try to prevent that problem from occurring again.
Exactly.